Have you ever felt like your heart is running a marathon, but you're just sitting on the couch? Or suddenly it's beating so fast, you can literally hear it in your ears. That sudden dhak, dhak, dhak could be more than just anxiety or too much coffee. It might actually be something called tachycardia. Hi, everyone. Welcome back to DocDecoded, the place where we decode medical mysteries in simple language. Today, we're diving into a very important topic tachycardia, when the heart beats faster than it should. Did you know your heart can beat over 100,000 times a day? So if it starts speeding up without a reason, it's like your car suddenly going from third gear to sixth gear while parked. What exactly is tachycardia? Let's start with the basics. Normally, your heart beats about 60 to 100 times per minute when you're at rest. This is what doctors call your resting heart rate. But when it starts beating faster than 100 per minute, and it's not because you're running, exercising, or just got scared by a cockroach, that's when we call it tachycardia. Quick question for you. Have you ever checked your pulse and found it racing even when you were just sitting? Let me know in the comments. I'd love to hear your experience. Why is it important to know? Sometimes an increased pulse can be completely physiological. However, if this increase regular or pulse rhythm is not regular, it can be abnormal as well, what is called tachyarrhythmia. It should be diagnosed timely. Now, let's clear up a common confusion. Have you ever felt your own heart beat? That is palpitation. Many people confuse this whenever there is some kind of dhak dhak, whether it's for faster beat or palpitation. Tachycardia is something that can be measured on a pulse or ECG. On the other hand, palpitations are not a disease or a number. They're a feeling. It's when you suddenly become aware of your heartbeat. Maybe it feels like it's racing, pounding, fluttering, or skipping beats. So, tachycardia is an objective finding, while palpitations are a subjective experience. But there's clinical significance of both. For example, if you have a fever and your heart rate goes up to 120, that's tachycardia. This will subside when you recover. However, if you're having some undiagnosed conditions like thyroid issue or heart problem, you will continue to suffer from this until treated. Likewise, if you feel your heart thumping inside your chest or fluttering like a bird, that's a palpitation. And interestingly, it can happen even when your heart rate is normal. At the same time, if you're continuously having palpitations, it might indicate some pathology in heart as well. But wait, isn't a fast heartbeat normal sometimes? How to differentiate between normal and abnormal beating? Yes, and this is where most people again get confused. A fast heartbeat is perfectly normal if you're exercising, feeling stressed or anxious, drinking coffee or energy drinks, or even just watching a thriller movie. But here's the catch. If your heart is racing without a good reason, especially at rest or it happens too often, then it might be a sign of an underlying problem. Please do not ignore that. Consult a doctor. Types of tachycardia. Not all the same. Okay, here comes the fun part. Doctors love classifying things. Seriously, we do. And tachycardia is no exception. There are different types depending on where the fast heartbeat starts in your heart. 1. Sinus tachycardia. The most common one. It happens when your heart's natural pacemaker, the sinus node, fires faster than normal, often due to stress, fever, dehydration, or anemia. 2. Supraventricular tachycardia, SVT, a fancy term for when the wiring in your heart above the ventricles misfires. This can cause sudden bursts of a racing heartbeat. 3. Ventricular tachycardia, VT. This one starts in the lower chambers, ventricles. It's more serious and can be life-threatening if untreated. 4. Atrial fibrillation or flutter. Instead of need beats, your upper chambers start quivering or beating irregularly and very fast. Think of your heart like a car engine. Sometimes it idles fast because of fuel, like fever or stress. But sometimes the wiring itself is faulty, leading to dangerous misfires. Question for you. Did you know your heart has its own built-in electrical system, like a tiny circuit board? Pretty cool, right? Now you might ask, okay, doc, so my heart is beating fast. Big deal. Why worry? Well, here's the deal. If your heart beats too fast, it doesn't have enough time to fill properly. That means less blood is pumped out with each beat, and that can reduce oxygen supply to your body and brain. This can make you feel dizzy, weak, short of breath, or even faint. In some dangerous cases, it can trigger a cardiac arrest. So yeah, tachycardia is definitely not something to ignore. Small reminder, if you're finding value so far, don't forget to share this video with a friend or family member. You never know, you might just help someone understand what's happening with their health. What causes tachycardia? Now comes the detective work. Tachycardia isn't just one thing. It has multiple possible causes. Your lifestyle triggers: stress, anxiety, lack of sleep, smoking, alcohol, caffeine, or energy drinks. Medical reasons: fever, anemia, dehydration, thyroid problems, lung disease, heart disease. Medications: some asthma or cold medicines can raise your heart rate. Structural heart issues, problems with heart valves, or previous heart attack damage. Sometimes there's no clear reason. It just happens due to electrical misfiring. So how do you know if you have tachycardia? The signs can include heart palpitations, that racing, pounding, or fluttering feeling, shortness of breath, chest pain or tightness, lightheadedness or fainting, fatigue. Sometimes people don't feel anything at all and it's only picked up on an ECG at the doctor's office. Question for you. Have you ever felt your heart suddenly skip or jump a beat? Was it scary or did you just ignore it? Comment below. I read all of them. How doctors decode it. If you walk into a clinic with "Doctor, my heart is racing," here's what usually happens. The doctor asks when it happens, what triggers it, and checks your vitals like pulse, BP and SpO2. Accordingly, they may suggest you some blood tests to check for anemia, thyroid problems, or other causes. ECG, electrocardiogram, the main test that shows the heart's rhythm and electrical activity. Holter monitor, a small portable ECG you wear for 24-48 hours to catch episodes. Echocardiogram, an ultrasound to see heart structure and pumping function. Sometimes, an electrophysiology study is needed to map out the heart's electrical circuits. How is tachycardia treated? Good news, it's treatable. But treatment depends on the type and cause. Here are the options. Lifestyle fixes: cut down caffeine, quit smoking, reduce alcohol, sleep well, manage stress. Medications. Doctors may prescribe medicines called beta blockers or antiarrhythmic drugs, but diagnosis should be confirmed. Medical procedures. For recurrent cases, there are techniques like catheter ablation, where faulty heart circuits are burned or frozen. Devices. Pacemakers or defibrillators may be implanted for dangerous forms. Emergency care. If someone collapses with tachycardia, CPR and shock with a defibrillator may be life-saving. Quick fact: you've probably seen movies where they shout "clear" and shock a patient's chest. That's exactly how dangerous ventricular tachycardia or fibrillation is treated. What can you do if it happens suddenly? This is important, so listen carefully. If you suddenly feel your heart racing, 1. Sit down and stay calm. Anxiety makes it worse. 2. Try vagal maneuvers. Coughing, splashing cold water on your face, or holding your breath and bearing down, like you're about to lift something heavy. These can sometimes reset the rhythm. 3. Check your pulse if you know how. Do you have a pulse oximeter at home? You can keep one for urgency. 4. Seek medical help immediately if you also have chest pain, dizziness, fainting, or shortness of breath. Life-saving tip: never ignore unexplained episodes of a racing heartbeat, especially if they keep coming back. Prevention is better than cure. Here's how to reduce your risk of tachycardia. Maintain a healthy weight. Exercise regularly. But don't overdo it without guidance if already overweight. Eat heart-friendly foods, fruits, veggies, less junk. Avoid too much caffeine or alcohol. Go for regular health checkups. Think of it like servicing your car. You don't wait for the engine to break down before you check the oil, right? Your heart deserves the same care. So the next time your heart starts racing for no good reason, don't just blame it on too much tea, coffee, or a stressful day. It might be your body's way of telling you something important. Tachycardia can be simple or serious. The key is not to ignore it. Tell me in the comments, what's the fastest your heart has ever beaten and what triggered it? I'd love to know. Was it the first time you talked to your crush? If you found this video helpful, don't forget to like, share, and subscribe to DocDecoded. And if you hit the bell icon, you'll never miss an episode where we decode health in plain language. Let us know on what medical topics you want us to decode simple. Until next time, take care, stay healthy, and keep your heart beating at just the right speed.